Now we have an important guest from the Eastern Virginia Medical School to discuss an important sickle cell disease program that the school administers. It is my great pleasure to introduce Dr. Ian A. Chin, Associate Professor at the Eastern Virginia Medical School, Department of Internal Medicine. Dr. Chin received his medical degree in 1996 from the University of Mississippi. He completed his internship and residency in internal medicine at the Eastern Virginia Graduate School of Medicine and earned a Master's of Public Health in a joint Old Dominion University EVMS program. He has been the medical director of the EVMS Sickle Cell Clinic since 2006. Welcome to Health Watch.
Terrence, thank you very much for having me here. It's my pleasure to be here.
Well, delighted to have you, sir.
Thank you.
Some people have a passing notion of what sickle cell disease is, but can you really tell us about sickle cell, how it's diagnosed, symptoms, and so forth?
Sure. There's a lot of misconceptions about sickle cell disease, but it's actually a genetically inherited disease. So you can only get it from your mother and father together when you're born. You can't catch it from anyone. That's been a misconception in the past, but it's a disease that's inherited which affects your red blood cells. So your red blood cells in your body carry your oxygen throughout your body, and everyone needs oxygen. But there are problems with the red blood cells. Specifically, there's a part of it that's called hemoglobin. The
Yes.
hemoglobin is what carries the oxygen, and in certain cases, patients can have different types of hemoglobin. There's lots of different hemoglobins. Hemoglobin A is a normal one. Sickle cell itself, there's a hemoglobin S, but there's all sorts of hemoglobins. There's a baby hemoglobin called a hemoglobin F. There's an C-type hemoglobin. There's a D-type hemoglobin.
I had no idea.
There's all these different hemoglobins, but when you have sickle cell disease, you usually have two inherited types of hemoglobin, which are both S and S. So sickle cell disease usually refers to someone who has hemoglobin SS. And being that it's a blood disorder, it can cause a lot of problems throughout the body.
Certainly.
You know, if you're not carrying oxygen, you can have problems with everything that the oxygen can't get to different parts of your body. So one of the biggest misconceptions, I think, is that most people think all sickle cell is just a kind of a pain disorder. And it's actually not. It's one component of everything. Sickle cell can affect all parts of your body. If you're not getting oxygen to your brain, for example, you can have strokes. If you're not getting oxygen to your kidneys, you can have kidney problems and kidney damage. Many people are used to sickle cell crisis when people have pain in their bones.
Yes,
And
yes.
that's usually when the sickle cell and the red blood cells affect the bones of the patient. But, you know, patients can have a lot of problems with their lungs, their heart, their liver, their spleen. So it's actually a very, it can affect all parts of the body. And I think that's where the misconception comes from, that it only affects people by causing them pain. It actually has a lot of different aspects that it can affect throughout your body, and it can cause a lot of problems. People have a lot of psychosocial problems. Since it is an inherited genetic disease, you actually have it from birth. Until death and stuff. So
And the red blood cells themselves actually take on a sickle or curved shape.
yes, when there is a flare of the crisis or the sickle cell, these cells that have the hemoglobin, this SS, they tend to deform. And the best way to describe it, it looks basically like a sickle. So
Sure,
the
sure.
S and
Right,
stuff,
right.
the cells kind of almost cause like a traffic jam.
Because there's a problem with the flow of the
Right.
blood cells because of the shape.
Yes, so the shape almost creates like a big traffic jam. The blood vessel can't handle it, so everything kind of gets backed up and big old traffic jam like you see in Hampton Roads.
Yes.
And you know, things can cause
That's
problems.
a
Things
good
can cause
illustration,
problems
yes.
down the line without oxygen getting to everything downstream. So
Now, you mentioned that you get the gene from both your mother and your father.
yes.
That leads me to ask the question, there's a distinction between having sickle cell disease and carrying the trait for sickle cell
Yes.
disease. What is that difference?
There is. Without getting into full detail, like I said, you get one gene from your father, one from your mother.
Right.
Sickle cell trait usually refers to having one gene of A type hemoglobin, which is a normal hemoglobin,
Okay.
and one gene of the S hemoglobin, which is the abnormal one. So most people with sickle cell trait actually do fairly okay. You know, you think 50-50, the cells are working okay. For the most part, patients don't have too many problems with just trait unless it's under extreme conditions like, you know, at the top of Mount Everest or something like that,
Understood.
or extreme stress. Sickle cell disease is when patients usually have a more severe form. The most severe form is usually when patients have both S genes, so mom S and dad S. There's some other forms like an S and a C, which is a different type of sickle cell disease. It's known as hemoglobin SC. But trait in itself usually doesn't cause problems for most individuals. However, you know, patients and individuals should be aware of that you can pass down
Right.
those genes to your children as well.
So just for point of clarity, if the mother and father both have hemoglobin A and S, they are carriers of they have the trait,
they have the trait.
and then that is when the newborn is likely to be born with the disease.
They could, yes. There's a 1 in 4 chance. So there's a half a chance that your father gives you S, a half a chance that your mother gives you S, and then it's a 1 in 4 chance that you have hemoglobin SS, which is sickle cell disease. So
that's why it's so important for folks to get the blood tested. And
it's
so
important
forth.
for folks to be tested and
Yes.
screened and everything. The Virginia Department of Health in the state does a very good job of this. All the hospitals do newborn screening. So, you know, a lot of patients before they have children or plan to have children should certainly have genetic counseling and things like that if it's a possibility.
So tell us about the EVMS Sickle Cell Disease Management Program.
So, you know, the program was developed back in 2002. I took over a little bit later in 2006 when one of our colleagues had to leave. But one of the things that we noticed was that as patients were growing older into adulthood, usually in that 21 to 24, 25 range, they were getting really lost in the Hampton Roads area for real follow-up. CHKD does a great job of taking care of our children. You know, my kids go there, except you can't stay kids forever. So eventually, you know, you don't want 24, 25, 27-year-olds going to the children's hospital.
Right.
They need to be out in the community and followed. But unfortunately, a lot of the patients who are older with sickle cell disease did not have a central place to kind of go to.
Sure.
A lot of patients were not in what we would call probably specialty care, at least someone who was familiar with treating sickle cell disease, looking at the things that would be affecting their life, their health. And there's just not a lot of providers out there. It's not only a problem in Hampton Roads, but it's a problem statewide in Virginia and nationally. You know, there's just not a lot of providers. So the program was developed by one of our colleagues who was interested in sickle cell disease and the effects that it had on the lungs and everything. And we wanted to try to, you know, help prevent complications. Have a place for these patients and patients to go. The initial program was started in cooperation with Sentara Hospitals, and we've actually expanded from there. But the program,
You have a bunch of partners, Sentara.
yes, we do.
VDH,
Yes.
Sentara.
Sentara works with us. The Virginia Department of Health works with us. Everyone knows United Way. They work
Yes.
with us, as well as the Urban League.
Oh,
in
very
Hampton
good.
Roads works with us. We actually partner a little bit with MCV and VCU up in Richmond, as well. So, but the program was initially developed to try to help patients not go to the emergency room in the hospital all the time.
Right.
You know, that's not the way to really get care. That's for some emergencies, as we know, but being that this is kind of a chronic disease that you have all your life, it's somewhere you want to get managed and, you know, look out for things that are going to happen. And you can't do that in the emergency room all the time.
I know. So you mentioned care. What kind of treatment options are available for people that have sickle cell?
I think one of the things about sickle cell that we know about is, like we said, it affects a lot of all your organs everywhere. So some people may have eye problems and they go blind. Some people have pain problems in their bones and need to be looked at. Some people have kidney problems. Some people have joint problems. Some people it affects their brain and they've had strokes. Some people actually have ulcers. So there's no way to tell. You know, you could have two patients with sickle cell next to each other, and one person might have the pain problems and one person might actually have heart problems. So everyone's different. It's individualized, and that's part of what makes it very difficult to treat, because everyone's different, has different problems.
And there are all these different types of hemoglobin.
There's all these different types of hemoglobins too, and we treat a lot of the patients differently because different people have different problems with different organs. There are some medicines that we use. One specifically is hydroxyurea.
I was going to ask you about that.
And we could talk about that.
Yeah. We're actually going to run out of time a bit here. Well, we need to do a full half-hour show on this, but if you could give us like a 2-minute description of hydroxyurea.
So hydroxyurea is the only approved FDA drug. You know, they've gone through clinical trials, rigorous things to look at. They've tried it and compared it to other medicines, other therapies. You know, we've given it to even kids now, so it's been looked at over a multitude of years, 10, 20 years. It's one of the few medicines that we know of that helps change the disease course in sickle cell. You know, patients can have less hospitalizations, they're less likely to pass away from sickle cell. It reduces the crisis and stuff that patients have. So unfortunately, you know, it's probably the only good medicine that we have that it can change the course of disease in sickle cell. And, you know, unfortunately, it's actually not used very much, though. You know, that's one
because
of the
lack of awareness and so forth.
There's a lot of problems with hydroxyurea. There's a lack of awareness to take in hydroxyurea. There's not that many people who actually prescribe hydroxyurea or are familiar with hydroxyurea and how to prescribe it safely, how to monitor it. There's even, you know, patients with sickle cell themselves have, through decades, the last 20, 30 years, sometimes there's misconceptions about the medicine.
Understood.
They're worried about taking the medicine. They're worried about side effects. It's hard to sometimes be adherent to the medicine. We've actually studied this before with VCU. Sometimes there's only like 20–25% of people will take it 80% of the time. And you know, if you don't take it very often or you're not compliant with it, you know, it's hard for it to help. You know.
Well, Dr. Chen, I hate to interrupt you, but I want to make sure that we get some contact information before we run out of time here.
Sure.
How can someone get in touch with the EVMS Sickle Cell Program?
We're at EVMS, we're at 825 Fairfax Avenue, Suite 410. The number's 446-8920 is direct number. And they can call us there and they can put anyone in touch with us if they have any questions about sickle cell.
One question I do want to ask you. You just mentioned adherence to hydroxyurea. What does that actually mean?
So adherence is just kind of making sure you're doing what you're supposed to. Some of it is just taking the medicine. It can be hard to take a medicine every day for the rest of your life. Sometimes patients have problems with other things, transportation, forgetting to take the medicine, coming to the appointments. There can be a lot of issues that patients may have related to whether or not they are on the medicine and on the therapy that they need to. We're actually working with a grant with the Virginia Department of Health and VCU to try to improve patients' adherence and compliance. It's a federally sponsored grant through NIH, which we're working with what we would call patient navigators.
And what do they do, very quickly?
Patient navigators are people who we're hoping will help patients with sickle cell with their therapy. You know, I can prescribe the medicine and say, here's your treatment plan, this is what we need to do for your medicine, but there's still other issues. You know, is the patient taking it?
Through all of that.
Are they going to their appointments? So our patient navigators are to help these patients be a little bit more adherent, compliant with these medicines.
Well, sir, we have run out of time. I want to thank you so very much for coming on and talking about this. And we're going to have to come back on at some point where we can spend a little bit more time with it and maybe even have some patients with sickle cell.
No problem. I'd be happy to talk to everyone.
Thank you so very much.
Thank you for having us here.
And we want to thank you, of course, for joining us for this edition of Health Watch. And remember, you can watch previous editions of Health Watch online at www.norfolk.gov/HealthWatch. If you'd like to drop me a line, you can email me at terrence.afra-anderson@vdh.virginia.gov. Please also feel free to give me a call at 757-683-8836. For the Norfolk Department of Public Health, I'm Terrence Afra-Anderson, and this has been Health Watch.